Aside from our previous videos, there's still some information you need to know about spaying and neutering your pet cat. Aggression in newly spayed cats. One of the most compelling arguments for spaying and neutering pets is that it decreases aggression. So what is going on when your newly spayed cat shows more aggression than ever, and what can you do about it? Anesthesia After-Effects. Aggression in newly spayed cats is usually caused by the anesthesia that remains in your cat's system after her surgery. These anesthesia after-effects can last from several hours to several days depending on the amount and type of drugs used and your cat's sensitivity. Think of your cat as being on a bad trip. She may be sensing and defending herself against threats that exist only in her drugged-out feline imagination. This will wear off. In the meantime, keep her in a calm, safe space far away from other pets. Pain and defensive behavior. Surgical pain is another reason that newly spayed cats may show aggression. Your cat just had major abdominal surgery and a complete hysterectomy. She is going to experience a lot of discomfort for a couple of weeks. This pain can make her feel threatened by your other pets and cause her to lash out at them. It is a good idea to use the pain control drugs prescribed by your veterinarian, but note that these can also make your pet behave in unusual ways and trigger more aggression. If this is an issue, continue to keep your newly spayed cat separated from other pets until her healing is more complete. Social upheaval. Aggression between your newly spayed cat and your other pets can be triggered by the mere fact of removing and reintroducing your cat to the household. Pets have pecking orders and social relationships, and when these are disturbed, dominant animals can get upset and lash out, and subordinate animals can decide the time has come to challenge the boss. For all of these reasons, most veterinarians will recommend that you keep your newly spayed cat away from other pets for at least her first 48 hours home, and be on the lookout after that so you can separate if there is any aggression. What does spaying a cat involve? Mother Nature spurs your cat to reproduce, regardless of the kitty's personal thoughts and feelings on the matter. A single female cat can produce dozens of kittens throughout her lifetime, which creates many extra mouths to feed. Spaying your cat early will prevent unwanted litters and encourage better health. Getting ready. You're not likely to deal with jitters or nerves from your cat before she goes in for her operation, although you may have to suffer through some loud vocal frustration when you take her food away. The specific procedures before surgery vary depending on your cat's age and vet's personal preferences, but generally involve removing food and water starting at midnight the night before her scheduled operation. She no doubts will express disapproval, much to your dismay. Follow any other pre-operative instructions from your vet to ensure a smooth, uneventful procedure. The operation. Because cats don't respond well to sex education and aren't responsible enough to use proper birth control, more drastic measures must be taken to prevent unwanted pregnancies in your kitty. Spaying your cat essentially means surgically removing all the female reproductive organs, including her ovaries, fallopian tubes, and uterus. Your vet makes an incision in your kitty's abdomen, pulls out her various innards, and snips them out. A little fancy needlework and your kitty is all sewn up, minus her girly bits, and on her way to recovery. Without her reproductive organs, Mother Nature's hold on her is broken, and she no longer feels the urge to mate or breed any longer. Hello. This video is sponsored by BMX Pets. Are you looking for high-quality cat collars at an affordable cost? Check out bmxpets.com. Use coupon code KittenLife to get 20% off. Aftercare. When you pick up your kitty after her operation, you may feel the urge to baby her during her recovery. Give in to this need, as your little girl should rest for a few days to promote proper healing. Keep an eye on her incision site to watch for unusual redness or signs of infection, and use an Elizabethan collar, the ones that look like an upside-down lampshade, if she can't stop licking it. Make a comfortable bed for her and prevent excessive jumping or roughhousing as she heals. If you have multiple cats, you may need to keep your delicate kitty away from the others until her strength returns and she seems on the road to healing. Call your vet if your kitty seems lethargic, isn't interested in food, or has diarrhea in the days following surgery. Myths about spaying. The lure of adorable little kittens to snuggle with can cloud anyone's judgment, and persistent myths surrounding spaying your cat further confuse the issue. One of the biggest myths in spaying your cat is that she should have at least one litter beforehand. This not only isn't true, but it's also hurtful to the kittens produced. Millions of cats are killed in animal shelters due to lack of loving homes, and letting your cat have a litter just because doesn't help. Going into heat or having a litter before she's spayed is not necessary, and actually can increase her chances of cancer developing later. Why have it done? The whole point of spaying your cat is to eliminate the possibility of having the unexpected pitter-patter of little paws as she churns out litter after litter of kittens. Generally speaking, spaying your cat changes her from a yowling, Horny she beast focused solely on mating to a calmer, more peaceful version of herself. Okay, so that may sound a bit dramatic, but removing her ovaries will prevent her from going into heat, when she may spray, cry loudly and pretty much make a nuisance of herself in her attempt to attract a tom. After spaying, this monthly display of carnal urges disappears. Her chance of mammary and uterine cancers developing decreases significantly once she's spayed as well, meaning she'll ultimately be healthier. When to have it done? Cats can enter their first heat cycle at only a few months of age, so you need to be quick to prevent future pregnancies. Kittens as young as 8 weeks old can undergo spay surgery, although many vets have their own age and weight preference for the procedure. A cat technically can have surgery while in heat or even during pregnancy, although she will lose all the kittens she is carrying. Discuss spaying with your vet to find out the various whens, whys, and hows associated with closing your cat's baby factory. Always consult an experienced veterinarian regarding the health and treatment of your pet. Anesthesia recovery in cats. Your cat may need anesthesia for a number of reasons throughout her lifetime. Teeth cleanings and extractions, sterilization, and injury repair are just a few procedures that require anesthetic drugs in felines. Give your fur kid special care after anesthesia to help her recover. The first hours at home. Whether you bring your feline home the day of her surgery or the next day, you will need to keep a close eye on her as she continues to recover from anesthesia. Each animal metabolizes medications differently, so how your pet reacts will be hard to predict. Some cats come to easily within a few hours while others seem drugged for days. The first few hours at home will be crucial. By keeping her warm, you will eliminate chills and trembling that is common after anesthesia. Check on your kitty frequently to monitor her recovery and intervene if any problems occur. Keeping your recovering cat safe. If you have ever had surgery, you know how unstable you feel as you come out of the influence of anesthesia. So you understand the importance of protecting your pet after surgery. By keeping your fur kit in an enclosed area, you will minimize her ability to wander into danger. If you have steps, you will need to carry your kitty because she will be too groggy to attempt them on her own. Large bowls of water pose the threat of choking or even drowning to your drugged feline, so it is vital that you limit water until she is over the influence of anesthesia. As your kitty gets back to normal, limit her activity and do not allow her to play roughly with other animals for 10 days to 2 weeks following her procedure. It's important to remember that cats age more rapidly than humans, making regular wellness care an essential component of a healthy lifestyle for your feline companion. Preventing illness and disease in our feline companions is easier, healthier, and cheaper than attempting to treat a problem once it arises. If you enjoyed this video, kindly press the like button. Also, don't forget to subscribe with notifications on, so that you don't miss out on videos like this. Thank you for watching.